Hi, my name is Dr. John Miller, and I serve as the editor-in-chief of Psychiatric Times, live here at the ASCP. And I'm here to talk about the next group of medications that were presented in the pipeline lecture. So one of them is a fascinating mechanism dear to my heart, and it's the first drug that functions with what's called an epigenetic mechanism. So it actually not doesn't affect the genes itself, but it affects molecules added, in this case, to decrease access to a gene and to change the way it's produced, and ultimately has what appears to be inflammatory, pro-mitochondrial, and other effects that are important in the treatment of major depressive disorder. Now, before I get to the drug, the fascinating thing about this drug is they did some really deep dives, and it works really well in women and it doesn't work in men. So it seems to be a gender-specific mechanism, and the data that they showed was very compelling. So it's called a SIRT6 inhibitor, which has an effect on histone acetylation, which basically, if you remove acetyl groups from the histone, that is going to shut down access to transcribing the gene. And ultimately, that creates changing levels of an enzyme, which is putatively how this drug is an antidepressant. So kind of a very different kind of story, an epigenetic mechanism, which is finally working its way into our armamentarium. So the second drug is ALT-203. And actually, we talked about this a year ago when I did an editorial on histamine, psychiatry's neglected monoamine. And ALT-203 is a histamine 3 receptor antagonist. And the histamine 3 receptor is an autoreceptor. And if you block it, you shut down the feedback loop, and that results in a surge of histamine. And a lot of people think of antihistamine, which is sedation and weight gain. But prohistamine is wakefulness, attention, alertness, and those kinds of important functions. And so this drug has shown in its early studies that it's very good at improving wakefulness and attention and alertness. And so early in development, we'll see how that one lands. So the third drug, I have to say, is also one of my favorite mechanisms. And it's in the middle of the story of how the NMDA glutamate antagonists work. And so we know that ketamine, esketamine, dextromethorphan are NMDA glutamate antagonists. And that results in a surge of glutamate. However, the intermediary is the AMPA glutamate receptor. And so if you can affect the AMPA glutamate receptor, you don't have to do anything to the NMDA, and you don't have to worry about dissociation or sedation or hypertension. And so there are several different companies looking at AMPA receptor modulators. And so this presentation was looking at a AMPA receptor positive allosteric modulator, which means it makes the AMPA receptor more trigger happy about getting fired. And so you bypass the NMDA, you're going directly to AMPA, and that will then go downstream in increased synaptogenesis and neuroplasticity. And that also is being looked at for major depression. And spoiler alert, there are a couple of those in development. So you have to learn about the AMPA receptor. Maybe there'll be an editorial.